Nearly 20 years ago, Rose Guest began experiencing pains all over her body that told her something was very wrong.
I thought it was just a flu, but because I was just aching and just never seemed to get better. And my mother, bless her soul, she kept saying, no, I think it's old rheumatism. That's what she called it. She didn't say arthritis, but she said rheumatism because that's what older people said.
Rheumatoid arthritis is an autoimmune disease that can affect any age, most often women in the prime of their lives.
It often affects young women, women in their 30s, 40s, or 50s, and it causes inflammation, which is swelling, redness, warmth of the joints, and especially involving the joints of the hands and the wrists. So it may involve the small joints in the fingers, as well as the wrists, and very frequently the feet.
Unlike the arthritis that occurs from aging and wear and tear on the joints, RA usually affects both sides of the body.
Patients can develop difficulty with performing their activities of daily living due to their pain and their stiffness and their joint swelling. And it can result in days off from work because of the arthritis and how active the arthritis is.
As time went by, I guess it just escalated, got worse. One time in my life, I was at a standstill because it just seemed like the pain just would never go away.
Experts say if RA is suspected, it is very important to seek treatment early with a specialist.
We have learned over the years that by detecting the arthritis early and initiating therapy early, that we can actually impact the disease in terms of the pain, the swelling, the amount of damage that the disease causes to the joints, and also in terms of the amount of disability that may result for patients.
Once the condition has been diagnosed, there are a range of treatment options available, including drugs taken orally and those through infusions or injections.
The treatments for rheumatoid arthritis are many. There are some that help purely with the pain. There are some that help with the inflammation, and some of the medicines work very quickly for the inflammation. But there are other medicines that, although they take a little bit longer to gain their full efficacy or to work, those medicines can have the greatest impact on reducing the progression of the disease.
Rose has used different medications over the years. She now believes she's found one that works well for her.
There's a lot out there, not only the one that worked for me, but there's more there's even newer ones now, so I've heard. So it's just so many, but it just have to be the one that works for you particularly.
They can reduce the difficulties that they're having with their daily activities and with their ability to work effectively and to have a good balance with their home and career life.
Rose is now able to do more of what she enjoys, cooking and decorating cakes for special occasions.
I can't run a marathon, but I feel that my marathon is just doing a little bit with my family and not staying home like I used to and not participating. So, yeah, I feel that I got my life back.
For more information or to make an appointment, call MUSC Health at 843-792-1414.